You can see these really well on the axials, at least some of them. As you scroll down through the knee joint, we see the iliotibial band here as a thickening of that lateral retinacular tissue. We see the biceps femoris tendon. In front of that, we see the fibular collateral ligament. So those two things come down together and form the conjoined tendon. More posterolaterally, we see the popliteus tendon wrapping around, going through the joint, through the popliteal hiatus, and down to the posterior calf. You can't really see the popliteal fibular ligament too well on the axials. We look at those on the coronals or sagittals. And then there are some other minor structures called the fibellofibular ligament and the arcuate ligament I'll talk about now. And they're not commonly routinely seen. So in fact, I had a really hard time finding a good example to show you of the arcuate ligament. It's a fascial structure. Here we see it on an anatomic image, and here we see it on an MRI. But this part of this is popliteus, so it's really hard to see. So I don't really concentrate on this. It's not really important mechanically as much as the other structures. So you don't have to worry about that one.